invasive foot and ankle surgery. And this morning I want to show you a patient, kind of a serious topic, and that is that we can correct toe ulcers in patients that are diabetic without having to remove their toes many times, even in the presence of osteomyelitis. Whenever a toe is removed, it definitely causes transfer problems and ulcers that occur in other parts of the foot, and then the patients lose their foot. What's interesting is the majority of ulcers that occur in diabetics actually are toe ulcers, and these can be corrected. We've done now literally hundreds of these at this point, so a lot of these have been corrected with this over the last 4 or 5 years. So I just want to show you some patients where we're healing and getting good results long term without having to remove toes, even in the presence of osteomyelitis. So let me show another patient. So here's one of our diabetic patients. When she came in, had a level 3 ulcer here, a stage 3 ulcer. And what happens in diabetes, she's a good case to look at that. So you look at her little toes, see how contracted they are? What happens with a diabetic, the neurological issues they have in their feet, what it does, it affects the intrinsic muscles in the foot, which some of the things that intrinsic muscles do is stabilize the toes straight. Well, her intrinsic muscles are not working. That's why her toes are contracting over like this. This first occurs normally with the first toe and the second toe, and also can occur first in the fourth and fifth toe. So what she came in with first was this ulcer here, was a level 3 ulcer, very deep, and we performed the Flexor Tenotomy on her in the office under local anesthetic. Now this is also a very inexpensive procedure. It can be done in the office very safely. Lots of research showing that. And this obviously heals. This is already healed for her, and she's wearing her regular normal shoe gear. So not having to wear total contact cast. So she's wearing a normal shoe. Now she did have an issue with the second toe, and we'll show you that pre-operative as well. We did that, correct that the same way. We do a little different with the big toe. We just cut the flexor lucis longus tendon when we're dealing with the big toe here. So really what I'm trying to point is that podiatrists are instrumental in correcting ulcers. We've done hundreds of these, and podiatrists throughout the country do this. And if you get a toe ulcer, it's very important to go to a podiatrist instead of having to go to someone who doesn't know biomechanics in the foot, who may amputate the toe. So you need your toes, you need normal gait, you need toes. So we don't want to amputate toes. That leads to other amputations, and actually leads to either loss of limb or even death. A lot of people don't live past 5 years after they have a below-knee amputation. The actual death rate is up to almost 40% of the people will not live 5 years after a below-knee amputation. So not only is this critical for the patient's health, it's actually critical for their life itself. So this is very important stuff we're doing here, and podiatrists are trained to do this.